stay at home or keep yourself isolated and do not mingle with other people until you seek medical attention. Also observing personal hygiene at all times. So making sure that if you do not have soap or water near you, you should be able to use a hand sanitizer which has high level of alcohol content in it. So that will be able to assist in terms of maintaining and of course combating the spread of this particular virus. Also, the Cabinet Secretary has suspended all public gatherings, meetings, games, religious events, and also suspending inter-school events like athletics. But schools will remain open at this point. The Cabinet Secretary also said that public transport has been directed, that's the public transport sector, has been directed to provide hand sanitizers to all commuters. Now, this is with accordance to a meeting they did have with all the public sector actors, public transport sector workers on Tuesday, and they've been directed to ensure that they provide, high levels of hygiene to commuters across the country, and especially here in Nairobi, and also avoiding social media misuse to cause panic across the country, and of course propaganda. So all Kenyans have been warned against probably propagating information or news that is not true. Also, the Cabinet Secretary says they will be giving daily updates on the COVID-19 status in the country and in the continent as well, and globally, looking at the fact that that began in China, and of course the spread has been very intense over the past few days and weeks. But he says there should be no cause for alarm at this particular point, since we only have one case and that person has been identified and is in quarantine at this point. Also saying that there will be some inconveniences, but they're calling on for serious citizen responsibility at this point. Also releasing a rapid response unit at any point. So if you feel like there might be a cause for concern, you've seen someone coughing, you're coughing, you're getting a sneeze, there is a rapid response unit that will be deployed at any point. We have our health reporter Eunice Omolo, who was at that particular press conference and has even more details of exactly some of the issues that were raised, and of course the questions that were being tasked to the Cabinet Secretaries present there. Eunice, thank you for joining us on this live broadcast. So we have confirmed the first case of the coronavirus in the country and some of the mitigation measures that the CS has talked about. What else are we as Kenyans expected to do? What else are we looking at? What do we need to know moving forward from this?
Thank you, Zainab Ismail. Kenya becomes the 15th country in Africa to report COVID-19 cases, bringing the numbers up to 146 confirmed cases on the continent. And the case is of a lady, 27-year-old, a Kenyan, who had traveled from the United States through the United Kingdom. And of course, this case is a shock to the country. But anyway, the Ministry of Health says that we are prepared, and the Ministry of Health is taking every measure to ensure that this patient is going on well with treatment. According to the CS Health, Kagwe, the patient is stabilizing, but will not be released until she tests negative. So far, so good. Kagwe says that they are tracing other passengers or other people that were in contact with this lady, and actually he has applauded the lady for giving the list of all the passengers or the people that she's come in contact with, and the Ministry of Health is following up with them. By and large, the Ministry of Health is also in consultation with other public sectors, stakeholders. For instance, they met with the public transport officials to ensure that at least they provide hand sanitizers for the passengers on board, and they also met with the business and community, where they've asked them not to hike prices on goods and services based on the outbreak of COVID-19 in the country. And the minister, back to the lady, the minister says that this case is an import case and it's not a homegrown case, and they're so optimistic that they're going to handle it and to ensure that this case is handled and there will be no further spread. But he still emphasizes the urgency or the importance of Kenyans to ensure that they set up or they keep up with the highest level of hygiene, hand washing, and to ensure that they avoid being in crowded areas. In line with that, the government has banned public meetings, has banned meetings, conferences, rallies, and has also issued a ban on visits to prisons for the next 30 days until they assess the situation. So far, the country has also put 13 countries on high alert, where they've issued travel advisory for Kenyans not to attend these countries because of the extent of the effect of COVID-19 in these other countries. And as we know at the moment that there are around 124 countries that have been affected globally, and in Africa we have 15 countries, Kenya included now, and so far we've had 5 deaths in Africa, and we've had 45 confirmed cases, and which Kagwe says that he's going to be optimistic that Kenya is also going to be, this case is also going to form part of the recovered cases that have been reported in Africa. Globally, we've had around 134,000 confirmed cases and about 4,800 deaths of COVID-19, but then again, we've also recorded around 62,000 recovered cases globally. And by and large, a lot of activities have been affected. We have the sporting industry, we have the entertainment industry, we have the transport industry, we have the business industry that's been affected globally. Tourism has also been affected in a number of countries, Kenya included. The CS tourism, Najib Balala, also indicated that by the fact that other countries have issued lockdown on some of the towns or some of the major cities globally, this ideally also reflects or trickles down to our country because movements of flights are also going to be affected. But so far so good. Kenya is highlighting on 13 countries, and it has also mentioned that it has now placed a ban on flights from Italy to and fro as a way of trying to mitigate or prevent further spread of this disease into our borders. As you know, this is the 3rd month since COVID-19 was discovered in Wuhan, the epicenter of the virus. That was in December 13th. Now it's 3 months on, and Wuhan itself has also been in lockdown for the past 3 months, and we have around 100 Kenyans who are still in Wuhan, but according to the Ministry of Health, all these Kenyans who are in Wuhan are in good health and they're doing well, and none of them has reported any case or they have not reported any symptoms of COVID-19. And so far so good. We are following up on the cases that are being reported globally and in the region. And closer home, but a bit away from home, we had the DRC Congo, which has now reported a case. And this comes after the country was celebrating their overcoming Ebola disease that has affected them adversely. And it will be remembered that this week the WHO had declared COVID-19 as a pandemic, owing to the fact that it has affected a lot of countries globally, and that has also paralyzed a lot of aspects in terms of the economy of different countries, and has spread across a lot of regions, and it is out of control. This was before it was declared an epidemic, and earlier on in February, the WHO had declared it a public health concern of international nature. And we're just expecting more information from the CS, going to give us guidance and keep us updated on what the ministry is doing in terms of following up on this on Kenyan index patients. And he has also rubbished. There have been a lot of misconception or talks that black people are not getting coronavirus, and the CS has termed that, has rubbished that statement and said the patient that we have in the country is as good as an African as we are, and we just all need to be concerned and put priority to hygiene, so that we can all try and fight and prevent the spread of COVID-19 in the country. I'll be giving you more updates as the day goes on. I'd like to take you back to the studio.